Good morning, everybody. I'm RD Sahl from the Journalism Department at Boston University's College of Communication. Great to have you here this morning for When Disaster Strikes, Reporting and Responding. I was in Haiti as a reporter several weeks after the earthquake in January of 2010, and I can tell you it's hard to get your head around a disaster of this scale. A place where you could stand in one spot, turn in a circle, and every building around you was on the ground. That, as we say in television news, was the establishing shot, the wide shot. But then there were the tight shots, the close-ups that brought the story home. And I think of the St. Francis de Sales Hospital in Port-au-Prince, a building that pancaked in the earthquake. Tents sheltered the injured and recovering. A garden tap was the only source of water for doctors and patients in the initial days after the quake. And the patients, the little girl, crushed pelvis, girdled in plaster, and the eyes of the children wide with shock at seeing things that no child should ever see. When disaster strikes, the medical teams respond, and so do the reporters and photographers. First responders all, but with distinct roles that intersect and, yes, sometimes conflict. That's the focus of our conference today. An exploration of the common ground and sometimes the tension between journalists and health responders. Our session today is a collaboration of the BU College of Communication, the BU School of Public Health, BU Center for Global Health and Development, and the Pulitzer Center on Crisis Reporting. We'll begin this morning with comments from our two deans. Dr. Robert Meenan is Dean of the BU School of Public Health. Thomas Fiedler is Dean of the College of Communication. Dr. Meenan, please.
Thank you, RD. It's a pleasure to be here, and I'm happy so many people have turned out. I just want to say a couple words about the connection of public health to disasters, and I sort of take it from the mission statement of the School of Public Health. Public health is interested in preventing death and disease in populations, in groups of people, in contrast somewhat to the individual care orientation of medicine. And when you think about disasters, it affects entire populations. And for public health to be there, preventing additional death and disease is really very much part of our mission. And increasingly over the last decade or two, public health has been increasingly global in its perspective. And so when you put those two things together, the concordance between public health and disaster response really makes sense. And then if you look at mission of our School of Public Health, we specifically talk about attention to the disadvantaged, underserved, and vulnerable. And by definition, after a disaster, you have entire populations that are disadvantaged, underserved, and vulnerable. So it's really appropriate for the School of Public Health to be involved in this program today, and in general to be involved in disaster response because it's so concordant with our mission. As RD mentioned, this is a partnership of 4 organizations, the School of Public Health being one of them, and our relationship with this is very much on the basis of the Center for Global Health and Development. John Simon, the director, is here. The Center for Global Health and Development originated in the School of Public Health many years ago. John Simon became its director about 8 years ago now, and just about I guess 2 years ago now, John, President Brown designated the center as a university-wide center, recognizing the relevance of global health to many, many activities across the 2 campuses of Boston University. So John has done a wonderful job of increasing the visibility of global health and increasing the collaborations in global health across the schools and amongst the schools and across the 2 campuses. I particularly want to acknowledge Jen Beard, who's a faculty member in the Center for Global Health and Development, for her central role in pulling this program together. And later you'll hear from Monica Ayungo, who's one of our faculty members. And I finally just want to close with talking about how pleased I am that the School of Public Health is able to collaborate with COM on this activity. We've been in discussions now about common interests. Health communications is a common thread for both of us, and particularly as we look at journalists dealing with disasters, it's in a way very much a health communication issue, and increasingly even at the individual level, as individual citizens are more concerned with their health care and information about health, health communications becomes a very important field. So we're very happy to collaborate with COM on this and look forward to collaborating with them on other activities. And at this point, I'll turn it over to the COM Dean, Tom Fiedler. Tom?
Good morning. Welcome, everyone. I'll be brief. RD, you set the stage for this very, very well. I think one of the things that is interesting about this conference is it may be, if not the first time, one of the rare instances when those 2 groups that converge on any kind of a disaster, war, hurricane, tornado, flood, earthquake certainly, have sat down and are beginning a conversation that may attempt to work out some of the issues that we find ourselves in. As Dr. Meenan mentioned, and RD mentioned also, that oftentimes this relationship it is symbiotic in a sense, in that both sides, journalists certainly will depend on the aid workers, the first responders, for information to inform the journalism that they're doing, and in many ways the first responders who are there, and I say first responders, those people who are providing the assistance effort sometimes over a very extended period of time, depend on journalists to get the story out, which enables, I think, the aid and the resources that they depend on to begin to flow. So there is this mutual dependence that goes on, and yet it's rarely something that the 2 groups come together and attempt to discuss and perhaps begin to work out what might be kind of protocols that will establish some better working relationships in the future. So that may be one of the things we hope for. I want to acknowledge John Sawyer here. John is the director of the Pulitzer Center and really was the person who provided the impetus for us to come together and do this, and we hope that this will go on. I also want to acknowledge Professor Elizabeth Marin, who's here. Professor Marin is she was a national correspondent for the Washington Post and the Los Angeles Times for many years. But her interest in disaster journalism, I think, again, dovetailed directly with what we want to talk about. It is, in many ways, it's a unique kind of journalism. It requires perhaps a unique kind of a journalist, the ones who, in that old saying, the ones who run to the sound of the guns in many ways, and or the ones who, when populations are fleeing, are going in the exact opposite direction to where the disaster has occurred. And to be able to do that in a way that ideally doesn't complicate the situation for those people who are either victims or are attempting to aid in it is a skill, and something that I think some of the veterans of doing that will have an opportunity to talk to us about. So again, these are 2 very interesting, different groups who come together and do something that I think on balance is very important to society and populations at large. So I'm really excited about everyone coming, and I appreciate your attendance. I'm looking forward to a very interesting day.